Welcome in college therapy. In this video we are discussing about traction. You are seeing in previous video about fracture and now we are discussing about traction. If you want to see previous video, then check out the playlist in channel. Now we have start discussing about traction. What is traction? Traction is the use of weights, rope and pulley to apply force to tissue surrounding a broken bone. Lower extremity traction. Both lower extremity limbs that uses Buck's traction. Buck's traction is a type of traction in which it is used when partial or temporary immobilization is required and to provide comfort following injury while awaiting surgical fixation, especially in hip and femur injury. Russell's traction. It is used to fracture of the tibia and works by supporting the flexed knee in a sling and applying a horizontal pulling force by use of traction tape and elastic bandage attached to the lower limb that you can see in the diagram. How it is. Now next, French traction. It is mainly used in young children who have fracture of the femur and congenital abnormality of the hip. Both the patient's limbs are suspended in the air vertically at the 90-degree angle from the hip and knee slightly flexed. These all are we discussed previously. Lower extremity traction. Now we come at the upper extremity traction, means upper both hand. You can see in this diagram, this is a part of the traction weight, spreader bar and bar for the fingers, moleskin covered by the elastic bandage. Dunlop's traction. It is very important and it is mainly used in various places in hospitals. It is used for the fracture of the upper extremity. It works in the form of horizontal traction which is applied to the abducted humerus, while vertical traction is applied for the flexed forearm. Applied for the abducted humerus and vertical traction is applied for the flexed forearm. This is the both different thing. Cervical traction. You can know what is the cervix part of the body. So, and as usual you can see in the diagram like that. Once again, this is the cervical traction. It is mainly used in cervical ailment and injury. It is usually used for shorter period. Weight should be not exceed 2.3 kg. If you exceed 2.3 kg, then injury will occur in the cervix part. So you have to precaution for that. The halter fits under the chin and around the back of the head against the occipital protuberance that you see here. You can fix the halter. This is the rehab part. Rehabilitation is the regaining of the strength and normal functioning in the affected area. A specific rehabilitation of each patient is based on the type of fracture and the method of reduction and immobilization used. Nursing management you can also see, but it is not important for physiotherapy and occupational therapy, but you can see alright for as a nursing student if you are seeing as a nursing student this video. Nursing care. These all slide for the nursing. You can see or you can download this PDF from College Therapy Telegram channel that you get link from the description box. This is the important care of patient interaction. During the traction period, what should you care about that at the patient? Traction: temperature, extremity infection, rope hangs free, ailment, circulation check, type and location of fracture, increased fluid intake, overhead trapeze, no weight on the bed or floor. That you should precaution during the traction period. Now this is overhead trapeze. An overhead trapeze will facilitate independent movement in bed. It also maintains range of motion of the upper extremity. Complication during the traction: early complication, neurovascular impairment, fat embolism. Embolism you can study. If you don't understand any term, direct you search on the Google individually and understand a particular word, like embolism, what is thrombosis, what is constipation, what is compartment syndrome, all that. Embolism, compartment syndrome, constipation from immobility and analgesic, deep vein thrombosis. Now delayed complication, that is the early complication and that is the delayed complication. Delayed complication: skin breakdown, joint stiffness, contracture, delayed union or no union or malunion. Malunion means less union. Thank you so much. This is all about the traction, and in previous video you can see all about the fracture, what we understand, all that you can see in this or previous video about traction, about type of traction, upper lower traction, lower extremity traction, what is the method and the names of the lower extremity, like Buck's traction, Russell's traction, band traction, and upper extremity traction, Dunlop's traction, cervical traction, and rehabilitation. Nursing management is also important for the nursing student, and complications. That's all. Thank you so much. If you like the video, then please hit the subscribe button and like the button, and share to your colleagues and friends with professionals, allied health science student. Thank you so much.